Hello, my name is Dr. David Alley, and today we're going to talk about carpal tunnel syndrome. This is my wife, Lori. What is carpal tunnel syndrome? Carpal tunnel syndrome is a condition where the nerve that runs through the wrist in this area of your hand and wrist becomes compressed and causes symptoms down into your hand and fingers, typically affecting these three fingers. It will cause a tingly numbness type of feeling, sometimes pain, and then it can gradually spread and involve the whole hand once it gets more severe. One of the problems that happens from carpal tunnel syndrome is that you can develop weakness of the muscles in your thumb, and that can lead to atrophy of the muscle in your thumb. We don't want to get it to that point, because once you have atrophy of the muscle, then that will never return. That strength will never get back to normal again. There's also issues regarding the muscles in the forearm here. These are the flexor muscles of your wrist and fingers. And these muscles sometimes can get very tight and be painful in this area and cause some of the symptoms that you're feeling down into your hand and wrist as well. So first of all, when we go to make an adjustment to the wrist, there's 8 carpal bones in this area of the wrist. The 4 in the middle and the 4 on the outside. So we want to push the 4 on the outside down this direction, and the 4 in the middle we want to push back this direction to try and help form that carpal tunnel that the nerves and tendons and blood vessels run through here on the wrist. So we're going to have Lori put her hand on this table like this. We're going to adjust the outside bones here. We're going to push those down this direction using the table, the drop table. And then we're going to do the outside 2 carpal bones as well. Okay. And then we turn the hand over, and now we're positioned so we can adjust those middle 4 carpal bones to push them back that direction. And that helps to create a little bit more space in that area of the wrist to allow to get rid of the pressure that's on that nerve that's coming into your hand. Now, the muscles that we were talking about are the flexor muscles right through here on the arm. We want to do some stretching and maybe some massage. You can do some massage at home. You can do some stretching at home. And we're going to show you a few stretches that can help with that. So first of all, you put your hand on the table like this. And then you lean forward over your hands. And that's going to stretch those muscles in the forearm right through here. And you can also do this stretch without using the table. You can pull back on the hand like that. And try and include the thumb with that stretch. There you go. And then that's going to give you a very nice stretch through here as well. Okay? Now when you're at home, if you're having trouble with the wrist, and there's any type of inflammation and swelling in that wrist, you want to put an ice pack on there. That's going to help to reduce inflammation, swelling, and pain in the wrist as well. There's a second condition that happens to people where the muscles in the forearm on the back side of the arm, they get tight through this area, and it causes a pain that comes down into the back of the wrist, and sometimes all the way to the middle finger, and sometimes this first finger. And what's happening is that the muscles in this part of the forearm are getting very, very tight, and it's causing a tendonitis that's coming down and causing irritation where the tendon attaches into the back of the wrist and also into the back of the finger here. So to try and alleviate some of that irritation, we can massage this muscle, and we can also stretch it, and we can ice it. So the stretch for that one is you put your wrist on the table like that. You want to have your fingers closed as much as you can. and then you lean backwards a little bit, and that's going to put a very nice stretch on those muscles right through here on the forearm.